Hi, everyone. We are now talking about upper GI bleeds. This is simulation number 6. So let's get into our little lecture. Except I forgot to share, I forgot to do the slideshow. So let me do that and then I can share. I am terrible at Zoom. Terrible. Um, Okay, so upper GI bleed, this is hypovolemia concepts. I touched a little on hypovolemia when we talked about sepsis. So let's keep it going. All right. Okay, so what's happening and why does it matter? So gastrointestinal bleed causes loss of circulating volume. That makes sense, right? So the gastrointestinal tract is huge and it now has a bleed. Okay. So the blood is no longer staying in the vascular space, it is leaving into the GI tract. So as the blood volume falls, the body's going to compensate. So it's going to work to get us to that homeostasis till eventually it can't. And then the patient will slide towards hypovolemic shock. So, what does it matter for nursing? The nurse's value is going to recognize the trend early and acting before the compensation fails. So we're going to identify that we've got a bleed somewhere. Maybe we're vomiting. Maybe we have bloody stools. There's a bleed somewhere, right? And then we're going to see that the vital signs are trending. Maybe they're trending, the blood pressure is trending down. Okay, so what are we going to do about that before it gets really bad? Maybe the patient's H&H is dropping. Okay, so we know that we were definitely working with a bleed and not maybe something like sepsis. So we're going to make sure that we identify this early and get a provider at the bedside as soon as possible. Our assessment technique and volume support are the core skills here. So like we need to know how to use our IVs and what we're going to be doing with that. So our concepts here that we're going to focus on are going to be orthostatic vital signs. We're going to look for signs of blood loss. What does the patient look like? What is their, is their skin pale? Are they cool? What is our hemoglobin over time? That will indicate a bleed. Then we're going to move to priority. We're going to recognize the slide into hypovolemic shock early. We want to secure that IV access for resuscitation. Anytime you're resuscitating, you want 2 large bore IVs. And then our interventions are going to be large bore IV access, safe device verification skills, and preparing for volume replacement. That's really going to be blood replacement. And then for our pharmacology, the concept of acid suppression to stabilize the clot. We want to give those acid reducers so that it doesn't continue interrupting the clot. We want to give fluid resuscitation to get that tank back to being full. And then holding agents that worsen bleeding. So, let's talk about what can worsen bleeding. Maybe the patient's been taking NSAIDs. Maybe they've had some chronic inflammation and the doctor prescribed NSAIDs, at a good rate, but this patient just is at high risk for GI bleed, and we've developed an ulcer because of the NSAIDs. And then, so we're not going to continue giving NSAIDs, right? If the patient had pain before, they're going to have pain after, but we're not going to give NSAIDs. And then we're going to educate about that as well. So our concepts connection is we have bleeding, right? So we have bleeding somewhere. Our circulating volume is going to drop. Our compensation is going to happen. So that heart rate is going to rise because what volume it has, it's going to try to get it around quicker. And then the blood pressure. So the heart rate is going to rise first, and then the blood pressure is going to fall, but that heart rate is still going to rise. Our assessment, we're going to use orthostatics and trend those to expose the hidden loss. And then our action is going to be large bore IV access and fluids come before the picture worsens. So nursing reminders. A normal blood pressure can still hide early volume loss. We want to do those orthostatics. And then a rising heart rate is often the first sign of falling volume. You want to verify placement of any tube before you use it. And then hold anticoagulants and irritants. Anticipate the need for blood products. All right, so you're going to kill it in your GI simulation, and you are going to be back here for the next one.